This is the breast model. You have muscles, you have skin, you have fat, you have the areola or areola, either one is correct, nipple, alveoli, which are the milk glands and produce the milk, and lactating ducts. These are called the lactation glands or alveoli. That's where the milk is produced. And these are the lactating ducts. And there's a sinus here, but I won't ask you that. So nipple, areola, lactating ducts, lactating lobes with the alveoli that produce the milk. So these are milk glands. Okay, that's it.
Aren't they alveoli?
Alveoli. That's the alveoli produce the milk, but a whole bunch of alveoli is a gland.
What are we going to have to know for this model?
Everything.
Everything? Okay.
Can you go over it?
Kidney. Okay. Ureter. Renal artery, renal vein. Segmental artery. Interlobar arteries and veins. Arcuate arteries and veins, and these would be the radiate arteries and veins.
Radiate?
Radiate.
Oh, segmental. This is segmental.
This one's segmental.
Oh, this is.
I think it's going to all the different segments. See, these are segmental.
Don't teach.
These are the interlobar. This is the cortex. Cortex. This is the medulla with the pyramids. The pyramids have collecting ducts in them. And in between the pyramids are the columns with the interlobar vessels. 85% of your nephrons start in your cortex. That's what all of these are. They're nephrons. Your collecting ducts are the stripes in the pyramids, and at the base of every pyramid is a papillae. So this little circle is a papillae, and these are papillae at the base of all the pyramids. That's where the urine drips into the calyx. This is a calyx. And the calyces come together into the pelvis and then drip out through the urethra. And once the calyces are formed, that's transitional epithelium lining them all the way through to the bladder and through the urethra, through most of the urethra. When you look at the nephron's a functional unit. That's 85% of them start in the cortex. This is the cortex. This is a renal pyramid. The collecting ducts are in the renal pyramid, as well as some of the loops of the tubules. You have renal corpuscles at the top of the nephron. You have a proximal and distal convoluted tubule and a loop of Henle connected to the nephron. So the nephron starts with a corpuscle, then drains into the proximal convoluted tubule, drains into the loop of Henle, comes up and becomes a distal convoluted tubule, and then they all drip into the collecting ducts, which form the stripes in the renal pyramids. This would be interlobar vessels, this would be arcuate, and these are radiate vessels. Okay. Then this is the top of a nephron. This is the renal corpuscle, and you have the glomerulus, which is the filter, and the Bowman's capsule. You have the capsular space where the ultrafiltrate drips. It's pulled out of the glomerulus, drips into the space, and then goes out through the proximal convoluted tubule, into the loop of Henle, and out through the distal convoluted tubule into the collecting ducts. And so this whole thing is the renal corpuscle, and it's composed of the Bowman's capsule and the glomerulus. All of the blood vessels leading into and out of and filtering are all arterioles, so it's a very high pressure filter. This is the afferent arteriole, which is fatter. This is the efferent arteriole, which is narrower, and that also increases the pressure of the filter. These little blue things are podocytes, which help pull out the filtrate, and this tangle is all arterioles, so that makes it a very high pressure filter. It filters about 1/4 of the blood per minute. And so you have proximal and distal convoluted tubule, renal corpuscle with the glomerulus and the capsule. You have the proximal and distal convoluted tubule, the loop of Henle, proximal and distal convoluted tubule and the loop of Henle, and collecting ducts. So
How would you ask the space?
Pardon?
How would you ask the question for the space?
I wouldn't.
You wouldn't?
No.
And why is there a different color like that?
They're just showing The inside, entrance and exit,
So it's all glomerulus.
yeah, this is all the glomerulus.
Glomerulus.
Yeah.
And this is more than, this is the efferent.
Afferent.
Oh, that's the afferent?
Efferent is exit, exit. Afferent is coming in.
Afferent. That's what I'm saying. This is the efferent?
No, this is
This is the
efferent.
efferent.
This is afferent, this is, it's these two,
Oh.
afferent, efferent.
Oh, so this is
Afferent, and this is
afferent,
efferent.